Today we're going to be discussing how to mix socket graft putty. Since we have changed the graft material and made it thicker, we also have an easier way of mixing the syringes together. First thing you want to do is you get the hydrate syringe, pull the plunger towards you to dislodge it. This will allow for the flow of the liquid to go into the other syringe a lot easier. Remove both of the caps. Screw the liquid hydrate syringe onto the green syringe, and you're going to slowly push the liquid into the powder. Hold the plunger with your thumb and give the syringes a few shakes. This will allow for the powder and the liquid to incorporate as much as possible. Next thing you want to do is start pushing the socket graft putty powder material back and forth until it mixes. If you have a hard time mixing the material, a good tip is to use the counter surface and push downwardly. Once you're done mixing, go ahead and push the entire graft material into the green syringe. Unscrew both of the syringes and place your tip, holding it by the hub. Sometimes if you hold it by the tip, it might break, so good thing to do is to hold it by the hub. Give it 3 minutes to activate. After the 3-minute activation phase, go ahead and fill your socket starting from the apex towards the gingival margin, and then follow the sequence of the directions of the socket seal, and your patient's good to go. Now, if you have areas of defects where you're missing the buccal wall, for instance, what you're going to want to do is incorporate some of our socket graft, some of our osteoconduct beta tricalcium phosphate granules, 0.5 cc of the standard. In this case, you don't have to give it 3 minutes to activate, because while you're stirring the graft material and the granules, the activation phase doesn't need to be waited upon. So what you do is go ahead and pour your granules in there. You're going to want to express half of the contents into a sterile bowl. Get a spatula and start mixing your material. Now that you have incorporated both the granules and the graft material, your graft material is ready to be placed.